Okay, Dr. Kathleen White, thanks so much for meeting with me today to talk about translation of evidence into practice and your work in that field. Why did you feel it was important to write a translation of evidence into nursing and healthcare practice?
Well, as we started to design the curriculum for the new Doctor of Nursing Practice program at Johns Hopkins School of Nursing, we wanted to have a basic course on evidence-based practice and the things that were involved with the review of evidence, picking practice questions. But we had designed a follow-up course on translation strategies once a recommendation for a practice change was made. And so we looked at all of the literature, and there are translation frameworks out there and models for care and translation work being done in many of the areas in education and administration and clinical practice. And when we went to look for some kind of a textbook to help our students and to pull things together for them for the course, there was really nothing there. So the faculty decided that we would write a textbook that was designed after our course, which is often the way textbooks end up being written. And what's, I think, important about the textbook is it has extensive bibliographies, reference lists in each one of the chapters, so that doctoral students who want more in-depth knowledge, information and knowledge about a particular topic still have the original source to go to, and so that the textbook is sort of a compilation of the translation work that we've done as faculty at Hopkins. Mm-hmm. So it was just an important outcome, if you will, an important outcome of the course design.
Wonderful. And it was a book that I understand was really needed. There was a gap, it seems, in that literature field.
Absolutely. And we involved, I think there was about 6 or 8 faculty members from Hopkins involved in the writing of it. So Dr. Dudley Brown and myself were the co-editors, and we did each write 4 chapters, I think, in the book, but we also involved other faculty members who were part of the DNP faculty.
Right. Okay, great. How have DNP graduates, would you say, been involved in the translation of evidence to influence healthcare outcomes? And where do you see that going?
Well, I think DNP graduates are those people who are very appropriately placed and now educated to be those translators of evidence. And I see them at the level in organizations, whether it be a small practice all the way up to the largest organization or system that could be out there, involved directly in clinical practice, in education practice, in administrative practice, needing to question what evidence is being used to drive their practice, to critique it, and then evaluate what needs to be translated. And the translation process itself is something they need to be involved in because they know their organization, as I say, whether it's small or large, what the culture is there in the organization, what I call it fit and feasibility for translation, so the appropriateness of using evidence in different settings with different patient populations and with different provider preferences. And DNP graduates are those people who are so well positioned in their organizations to do that.
Mm-hmm. Right.